the strokes, the seizure, the heart attack, you know, the heart transplant, you know, and don't forget, I had cancer before that.
It's no wonder his friends nicknamed him Miracle. Coming up, Eddie Taylor shares his journey to a new heart while also battling prostate cancer. Good morning, I'm Alexis Del Cid. Welcome to season 6 of All Things Heart. Eddie Taylor's health journey has been anything but typical. He had 5 major medical issues in just 3 months, and 3 of those involved his heart. It meant his doctors would work as a team to save his life.
You're a year out now, no sign of any cancer, which is perfect.
Oh, good.
Yeah.
Wait a minute. This is my year.
This is your year.
Man, this is my year.
Yeah.
Yes, it is.
Yep.
It's my year.
Despite everything he's endured,
Thank you, Lord.
Eddie Taylor is optimistic when he looks to the future. And when you learn everything he has survived, you'll understand his new nickname.
Everybody gave me a nickname, Miracle.
A prostate cancer diagnosis, surgery to remove his prostate, then a heart attack, stroke, and a heart transplant just 3 months later.
I saw you at a bad moment in time, so I'm glad we're on this side of it.
Oh, so you were there.
He and his urologic oncologist, Dr. William Parker, clearly have some catching up to do in this appointment.
I came up and saw you when you were in the ICU before the heart transplant.
Okay.
Because they also need me to weigh in on that to tell them that it was okay from your prostate cancer for you to have the transplant.
Eddie doesn't remember that moment or most of the moments leading up to that. All he remembers is being back at work after his prostate removal and feeling pretty good until...
The last thing I remember is a doctor tapped me on the shoulder and said, Eddie, don't be alarmed. He said, you had a heart attack. I didn't know what to think, you know. My mind was just going crazy, you know, because I was like, no, I'm at work, you know. I'm supposed to be anyway. They told me that my heart was weak, you know, and they had to put me on a machine called an ECMO machine. Time was racing against me. I had to get a heart, you know, soon.
He was airlifted from a different local hospital to the University of Kansas Health System.
I actually rode on a helicopter, and I wasn't even awake to even see the whole ride.
Just days later, Eddie had a new heart. And on this day, he's meeting with Dr. Parker to discuss getting back his sexual function.
There are injections, there are pumps, there are things that we can do. But I want to touch base with Dr. Shaw's team and just see what all can I do right now.
Because of his heart transplant, it will require collaborative care with his cardiology team.
The hard part is that if you hadn't had everything that happened with your heart, this conversation 6 months ago, it would have been a pretty easy pathway to figure out. Try not to get too frustrated right now, but hang in. I've got tricks up my sleeves.
Okay, answer free.
Yep.
You've done a good job, man.
No, you did the hard part.
Yeah, you did a good job.
We're so happy to have Eddie Taylor in studio with us today. Thank you for being here. You are just a delight to hang out with, just the 30 minutes we've been sitting with you here on the set before the program. We also have his urologic oncologist, Dr. William Parker, and we have Eddie's transplant surgeon, Dr. Matt Danter. I want to start with Eddie, though, because Eddie, you've been through the ringer. You had so many things happen at once: prostate cancer surgery, heart attack, stroke, heart transplant. How are you feeling this morning?
I feel great this morning. I feel like $1 million today.
Yeah, go on.
Well, I'm just saying, I'm just glad to be here, and I see everyone that I first seen from the beginning. So that's a breath of fresh air for me.
And you're sitting here smiling,
yes,
talking to 2 of the doctors that saved your life. It's remarkable. Were you aware of any heart issues before your cancer diagnosis? Was there any family history?
No, not at all. And I was going to my primary doctor, you know, as they scheduled me to come. And that's what I don't understand, you know. I was doing all my daily checkups and monthly, so I was going in whenever they told me to, and it's just something that came just out of the blue. So that's all I remember.
That's the worst kind of event, because you feel like your body suddenly tricked you or betrayed you with some nasty surprise. Dr. Danner, many people who don't work in a hospital had never heard of ECMO until the pandemic. Then that's all we heard about was ECMO machines keeping people alive. What do ECMO machines do? How do they work?
Well, there's two basic types of ECMO. One is primarily for lung failure, which is what we heard about mostly during the pandemic. And in Eddie's situation, it's basically a heart-lung machine at the bedside that takes over the role of the lungs and the heart to provide a circulation for the person who requires it that is compatible with life. It's basically the most amount of support a person can be on and still kind of technically be alive. So the goal with ECMO is to basically artificially establish a circulation that's compatible with life.
So do the living for you until you can get a permanent plan.
Well, it moves the blood around the body so that so that you preserve and recover end organs, and then you can move on to what next steps are if they're available.
So before all this, Dr. Parker, what was Eddie's treatment plan for his prostate cancer?
Yeah, so Eddie had a prostate cancer that required treatment. It was aggressive enough that we needed to do something, and if left untreated, it would have hurt him in the long run. And so Eddie's plan was to remove his prostate, and specifically to do surgery to take out the prostate, take out the lymph nodes, and try and preserve as much of his functional recovery as possible.
And that's the Retzius sparing surgery that we talk about. We have some video of it. It's a prostatectomy.
Correct.
And this is some video of you performing a prostatectomy. It's not Eddie in that video, but it is the same kind of procedure that Eddie had. What do you do during a prostatectomy?
So, I mean, essentially we remove the prostate. So we remove the prostate, which sits in between the bladder and then where the urethra exits out of the body. So there are some urinary consequences to doing this. A space of Retzius sparing surgery specifically is a way to try and minimize the incontinence, which is the main side effect of taking out a prostate from a recovery standpoint.
And the Retzius is a part of the body that you're trying to spare?
Correct. So the space of Retzius is a place that exists in front of the bladder. It's the usual route by which we access the prostate. But unfortunately, to use that pathway, we're destroying a lot of the support the bladder has that gives continence.
Got it.
So this other approach allows us to preserve all of that support so that men can recover much quicker.
And so before this kind of surgery, do you have to check a patient's heart health?
So anytime we do surgery, we do some preliminary checks on somebody's fitness to undergo the procedure. That can be simple things like, can you climb flights of stairs without getting short of breath? Functional assessment, not necessarily a full check like having a heart cath or an EKG or something to really look at the structure of the heart. Surgery is a big stress, and so I will be honest, it surprised me that Eddie had the issue he had so shortly after surgery. I would have anticipated him to have an issue during the procedure I did. I mean, essentially, I put him through a stress test during a procedure, and he tolerated it fine.
So if anything was going to happen, you would expect it to happen then, unfortunately. But then Eddie was saying, Dr. Danter, that he doesn't know what happened. There's no history. Is there a way of telling what caused his heart problems?
No, I mean, the usual things are the usual things, so family history, smoking, hypertension. But the type of heart attack that Eddie had, too, being so dramatic, it's not one that is sort of necessarily predictable anyways, because you have you kind of have like the slow, gradual buildup of coronary disease that occurs in more older people, and you have sort of progressive symptoms. But when you have something dramatic like this, it's usually not even anything you would pick up on a scan.
Is there
or
a name
dye test?
No, for the type of heart attack?
Yeah, it was a ST elevation MI, but it's usually the 30 and 40% lesions that are really plaque rich and they rupture suddenly and occlude the vessel, which is how you get as dramatic a presentation as Eddie had. And so that would not be something that typically would not be something that shows up on preliminary tests anyways. It's the reason why still sort of upwards of 40% heart attacks are still fatal for people, because they're this dramatic. We just don't see them because they don't make it to the hospital, or they don't have alternative therapies that they can have access to.
And here, Eddie, you are sitting here this morning. I could see the worry on your face every time we talk about how serious it was. But it's good to have you smiling and talking here. Looking back, do you think there were any signs, hindsight's 2020, that you might have, like a symptom you might have just written off as, oh, I'm tired, or anything that gave you any sort of advance notice?
See, nothing. I mean, I didn't have any shortage of breath, or I didn't feel like I couldn't move or climb any flight of stairs or carry anything. I mean, I was just perfectly normal. You know, I mean, there wasn't a sign of anything at all. You know, I mean, I didn't feel anything even years back. I mean, I was perfectly, you know, healthy. You know,
You're feeling
I mean,
good. You just beat cancer,
For
right?
sure. Oh, I love that part. Yeah, I love
we.
that part. Yes, indeed.
Go on.
Yeah, like I said, I was just it just came out the blue. I mean, I was at work one day, you know, for a skills check off, and my skills check off was over, and something just told me to go to the restroom, you know, and I'm glad I did, you know, because I was about to get back in my car and drive home. You know, so something in my head just said, just go ahead and make that turn, go ahead, go to the restroom, you know. So I guess about when I was heading into the entrance of the restroom, about 10 seconds later, I just felt just kind of weird right in my stomach area here, you know, and I was trying to hold myself up, you know, and then I couldn't, you know, so I just went down, I guess, you know, and one of the coworkers said they heard a loud boom, you know, and that's when I woke up and I saw Dr. Dent.
Oh gosh, that's scary.
Yeah.
Days later.
Right, how much time had passed? So your last memory was days, there's a multiple days span that you have no memory of.
Correct.
Yeah.
Yeah, and I just,
Boy, that's weird.
I know, and I just listen to the stories that everyone tells me, you know. Everybody has a version of the story, you know,
Yeah.
so it's like, wow, you know.
Yeah, I think it was like door to transplant was like 4 or 5 days total.
And so those 4 or 5 days are just gone, which is kind of a good thing. Are you glad you don't remember? You've talked about trying to remember,
Well,
but
some of it, I mean, I'm glad I'm alive, you know,
Yeah.
but, you know, I always ask questions, you know, what was I doing at this time, you know, what happened after, you know,
right.
how did my body react to it, you know, and things like that, you know, but, yeah, I mean, it's probably a good thing that I don't remember, you know. So,
Well, this is kind of a strange question, but was Eddie then just unconscious all that time, or was he talking and doing things that he just doesn't remember?
He had a breathing tube in and
Nothing. So
meant
he
everything.
was
So, yeah.
out.
Yeah, he basically came in here in shock. We escalated therapy to ECMO, and then he woke up with a heart transplant.
Oh my
So
gosh.
That's kind of the
Wow.
sequence of events.
Before the heart transplant, Dr. Parker, you talked about being called in for a consultation. Was that a consultation between you two? Was
Between
it a whole
our team,
Yeah.
but basically, you know, typically we want 5 years clear from prostate or any other form of cancer before you'd be eligible. Now we make exceptions, and we do, you know, for circumstances wherein we have good oncological evidence that this should be a cure, and we move forward with things, and the extremis that the patient's in. So,
Extremis meaning he
how
was in
sick he was.
bad shape.
Yeah, they didn't have a ton of options yet.
How many years had he been cancer-free at that
We were
point?
in the first year after surgery at this point.
So not even close to the 5 years.
No.
No.
What made you feel confident that, yeah, he can handle this?
Yeah, I mean, I think the underlying concern is a couple of things. So one, solid organs are a limited resource. So obviously, you don't want to transplant if you know somebody has a cancer that is likely to kill them.
Right.
The second issue is there's a concern that with immunosuppression to keep the transplant from being rejected by the body, that a cancer, if still there, might go unchecked and might spread and become more aggressive.
Right.
Thankfully, prostate cancer is not a cancer that really is affected by the immune system very much. And so given his surgery and what his pathology showed and the fact that we know prostate cancer doesn't have that immune phenotype, it was safe.
You felt good.
Right, and this is a very common scenario. So prostate cancer is common, organ transplants are common. So it's a question that comes up, honestly, quite frequently.
So it's common that it happens at the same time?
Well,
Or was this
no,
a
I mean, we have
rarity?
you know, relative contraindications, and they're guidelines. They're not rules. It's not like someone, you know, says you've broken a rule or something like that.
Right.
But typically in circumstances unlike Eddie's, we want to wait 5 years or something like just to make sure that cancer doesn't recur, another cancer doesn't develop, because
This
there's
is
some syndromes.
the human element that we always hear our doctors talk about is you're not treating Eddie like a number or a rule. You're treating Eddie like Eddie.
No,
Like you knew what he
everybody's
could handle. Yeah. What would have the options been Could Eddie go without a transplant, or was this the only option to keep him here?
This was the best option, we thought. There's, in heart failure surgery, we always have a plan A and a plan B and a plan C, like I've talked about before. So yeah, there were other options potentially to transition to a more durable form of mechanical support, like a durable LVAD, or to at least wean, because you can only be on ECMO for few weeks or so before bad things start happening. So there were other options, yes, but we had some minor sort of yellow flags about the cancer history and these kind of things. Once those were resolved, then as sort of strange to use the term straightforward, but the most direct and straightforward and definitive therapy was transplant.
We're going to get some viewer questions. In fact, I already see some coming in. We love it when our viewers send us questions live. You can write us your questions or your comments on YouTube, Facebook, or you can send them to us on the All Things Heart email. All the links and how you can connect with us right now in real time are here on your screen, and we will be reading your comments and asking your questions. And while we give our viewers some time to submit their questions, we have a picture that Dr. Danter shared with us during Eddie's heart transplant. This is quite a crew. Is that the typical number of people that are in a room during a heart transplant?
Yeah, that's about. There's probably 2 or 3 people that are not listed there or not shown there as well.
So are they all?
So on
nurses?
The right side of the
Yeah.
picture, as we're looking at it, is the perfusionist. Anesthesia is behind the drape. There's me and one of my surgical partners, Tyler Zorn's there. There's 2 scrub nurses, one that was training. There'd be another circulating nurse. There'd be a perfusion tech, anesthesia tech. So it's about 9 or 10 people that are in the room when it's going on, and then another surgical team goes and procures the heart and brings it back. So there's that group that Todd Crawford went and got the heart for.
Another cardiologist.
Cardiac. I don't call you names. That's not very nice. I'm a heart surgeon.
Heart surgeon.
Yeah.
I'm sorry, heart surgeon. You're all heart experts to the layperson. Sorry, I'm a layperson here.
But yeah, so there's a whole other team that goes and procures. So it's yeah. I mean, cardiac surgery is a team sport anyways. Right. It's a pretty elaborate setup as it is, but heart failure has also got that extra layer of we have a whole other group of people that are on somewhere else in the country trying to make sure we make all the right decision.
You can call me a reader if you want. Just read.
No, that's an old joke that because I get called a cardiologist all the time.
All the time.
My dad's a cardiologist too, so it's.
Oh, so how does he take that joke when you say, I don't want to be called a bad name, don't call me a cardiologist? I'm sure you do friendly living.
He knows my, yeah.
We have a picture of your dad coming up later, but sit tight. We've got a lot to get through. Eddie, how did you feel when you woke up and you see a team of people standing over you and they say, you have a new heart? Oh, and by the way, you've been out for 5 days.
Right. I mean, I was terrified. I mean, I was just going crazy, because when I woke up, I just looked up and I just saw, I think it was like bright lights on me, and I think I saw white coats everywhere, I thought I was in heaven for a minute,
Oh,
no.
Were you abducted by aliens?
Right,
So
I didn't know
weird.
what to think. Yeah, I started looking around and and I heard you had a heart transplant. I did.
Excuse me?
Yeah, I was like, I did, and it couldn't register in my head, and it's like, wow, heart transplant.
Your last memory was walking to the bathroom at work.
Right, that was it.
So odd.
That was it. That's the last I remember, And like I said, I woke up and I saw Dr. Danter, and he said, you had a heart attack. He said, you had a heart attack, and I'm like, God, and transplant, and I couldn't believe it either, you know. So I just kept looking around, and I'm like, and I was scared, because,
Sure.
And then I see, and I knew something had happened, I'm trying to see, did I see my mother or my sister? I saw somebody, and I knew something terribly had happened, because it's like, I'm in Kansas City, and I know they live in St. Louis, so I'm like.
You see your mom, something.
Right, yeah, for
big.
sure, So I was like, oh man, and it still couldn't register. I mean, and things, and I'm still in disbelief, that it even happened, but it happened, and I'm here. And I thank both of these guys, for fighting for me,
Incredible.
I thank you both for it. You know, I mean, you did a fantastic job. You know, I just thank God too. You
Filled
know,
with gratitude.
Yeah, for reaching down and guiding you all's hands to help me get through it. Yeah, I really appreciate that.
When we met you for the first time, you were with Dr. Parker and you were talking about restoring his sexual health to what it was prior to the surgery. Is that a common journey for your patients?
It is. Certainly this was more complicated just because there was this time that, you know, he's having to recover also from a heart transplant that slowed the recovery down, but it is a very common aftermath of taking out the prostate.
And you talked about you have all sorts of tricks up your sleeve and things you can do. It sounded very reassuring. It sounded like something that might surprise patients who were coming in all anxious. Do you find that once you tell people what their options are, do you see the relief
Oh, yes.
wash over their face?
Just knowing that there are things that we can do depending on how far somebody wants to go, certainly, I mean, it would relieve me. It relieves most folks because it just gives you a sense that, okay, even if things don't go the way I expect, there's still plan A, plan B, plan C. There are other things that we can do.
There's so many different plans you can implement. Do you have to be careful of what kind of medications Eddie takes now because of his heart transplant that you normally would prescribe to a different kind of patient?
I am being extra careful with Eddie. Now, some of that's, you know, I'm not a cardiothoracic surgeon or a cardiologist or a transplant surgeon, and so, you know, some of the care that I'm taking is because I don't routinely prescribe the meds that he's on, and so I just want to be incredibly cautious that I'm not going to do something that's going to interfere with the most important thing, which is his heart.
And that's good. That's why you all work as a team.
Correct.
I want to get to some of our viewer questions because they are coming in right now. Fred wants to know, is it possible that the prostate cancer could have caused the heart problems?
Not from anything that I can relate to it. As I mentioned, I would have expected if there was some major heart issue, it would have declared itself during the procedure, not that the procedure would have caused it.
And
But it's a good question because there are certain types of cancer treatments, particularly anthracycline-based chemotherapeutic agents that do have a direct effect on heart muscle. That's usually much later than like Dr. Parker, much later than after the treatment has occurred for the cancer, and it's more for, you know, we see it with breast and other forms of cancer, but the presentation, it doesn't present like Eddie presented. You know, you did, Mr. Fiala just had a good old-fashioned, big, really bad heart attack, and
lucky you.
Yeah.
Good old-fashioned heart attack.
Yeah.
But here you are.
Yes,
I just want to keep saying that to you to reassure you. You're here. You're
Yes, I
okay.
am.
It's real. It's
I know,
freaky to
it's
talk
real.
about it after the fact, though. Becca wants to know, Dr. Danter, when you have a patient on ECMO, how does that affect the search for a heart donor?
That places the patient typically in the region as the highest status person that's around. Now, still, there may be other hospitals that have someone else who's also on ECMO. Then it becomes who's been on longer in terms of priority. But that makes you the highest status that you can be listed at.
That bumped him to the top of the list.
Right, which is why, you know, there's some nuance to it, but that's why, depending on you know, blood group and size and gender, there's some things that may delay, but that's why it can go very quickly once you're on this amount of support.
Question from Jonas. Jonas wants to know, Dr. Parker, when you found out Eddie was on ECMO, what was your first reaction?
I wanted to get up to the hospital to see him.
Yeah.
That was my first reaction. I mean, Eddie and I, you know, the prostate cancer journey is one where you really do get to know somebody pretty well, both in the pre-diagnosis, diagnosis, treatment planning, counseling, and so, I mean, I had met Eddie's kids. We had a good relationship, and so when I heard that happen, I wanted to go and see him.
And when you saw him, you obviously have no memory of this, but did you see him after he woke up from his surgery? Were you able to run up there and see him at that point too?
I was unable to go up and see him at that point, so I unfortunately saw him during kind of the worst moment when he had ECMO and was unconscious. And
you met his family.
Correct.
Under the worst one of the worst circumstances. Have a question from Denise. Denise wants to know: are people usually awake or usually asleep when they're on ECMO? We have interviewed patients who were awake on ECMO, but
so to be as ambiguous as I can, the answer is yes. So
yes and yes.
There's different types of strategies, and it depends to some degree on how sick the patient is. We have had people on peripheral ECMO that are extubated and awake. We have had people that are on peripheral ECMO that we actually try to ambulate. We have had people on VV ECMO that we try to actually get them to get up and walk around and do these kind of things. So it depends on how you're cannulated and how sick you are, basically. But yes, some people are awake. Some people are not well enough to be awake, or, you know, to some degree we're trying to preserve their sort of psyche and these kind of things by not letting them experience
It'd be terrifying.
everything that's going on. Yeah.
To
have a breathing tube. If you have, you know, you got a breathing tube in your, if you got a breathing tube in your mouth and you're, you know, you don't need to be awake for all that.
Right.
It's kind of, yeah.
So breathing tube,
unpleasant.
you never have a patient awake with a breathing tube.
Well, every
seen
patient
it.
with a breathing tube, we wake up to some point to try and get the breathing tube out. But in this circumstance, that happens after his transplant.
Wow.
So it's, you know, we're trying to minimize trauma and minimize variables that we can't control when people are that sick.
Denise had a follow-up question. Can you ask Eddie if he remembers anything? But the answer to that is no. You just remember waking up on the alien ship with a white light in your,
Right.
light in your eyes.
That's it.
June wants to know, can you ask Dr. Parker, how often are you consulted by cardiothoracic surgeons or other specialists? And just so you know, June wrote cardiologist, but I changed that to cardiothoracic surgeon. So how often is it, Dr. Parker, that you're consulted by other specialties, including surgeons and...
I mean, I think the generic answer is I'm consulted frequently. Now, for specific or situations like this where we're talking about transplant clearance, I would say it happens a few times a month that the question comes up, you know, where are we at in the cancer journey? It's very rare that it's as urgent of a situation as this. Most of the time it is more in the controlled, hey, you treated this guy several years ago, where are we at? You know, what's the prognosis look like? That's typically how that goes.
That's such a fascinating story, interesting and inspiring that you're here today. I want to get some final thoughts from our guests, and I want to start with Eddie. Eddie, you have such a positive outlook despite every curveball life has thrown at you. Where do you get that from?
Well, I don't know. My mother's a good person, you know. She's always had a good heart, you know, and I just kind of, I don't know, I just kind of had that in me, you know, treating people, you know, with kindness and respect, you know, and it just kind of, it's been with me, you know, for a very long time, you know, and they tell me, you know, by me being so positive, you know, with a good heart, is probably what got me through most of all this, you know. It's like, I think they got on my folder, I think they got a picture of me just smiling on there, you know, and people look at that picture like, oh, this is a good guy, you know, this is a good guy here, you know, because they just kept coming in my room, you know, and every doctor said, you remind me of somebody, you know, and I can remember a doctor showed me a picture of a soccer player, you know, that I reminded him of, you know. And he showed it to me, and I was like, man, yep, he smells exactly like me, you know what I'm saying? It's like, yep, yeah, sure, yeah, so, you know, and I always been the type, you know, to kind of joke around and play around, you know, and try to uplift others, you know, and stay positive, you know, so I guess that's what got me through, you know, so I'm happy that it turned out this way.
It's a testament to you that everybody smiled when they knew you were coming on the show.
Oh.
Eddie's coming in? Great. You're that kind of guy.
I have fans on the parking lot. You know what I'm
You do? Parking lot, they're waving, cheering you
yeah,
in.
Fans, yeah,
Like you're coming to the end of a marathon. Dr. Parker, what are your thoughts when you hear his friends call him Miracle?
Oh, I think it's a great name. I think it fits. I mean, you've heard the story.
They made me
Yeah.
the chain. I got the chain on. You know, it says, I'm a miracle.
You do?
Yeah.
Let's see it. You have it on? It says,
Yeah.
I'm a Miracle?
Yeah.
Like a pendant or something?
It is.
Oh,
Yeah,
that's
I
so
don't know
cool.
if you can see it or not,
It's
but
just underneath your shirt.
yeah.
I don't know if we can hold that up
Yeah.
for the camera. It might be too hard to zoom in on that. Go to this one here.
Yeah, it's
I love that.
nice. Yeah, it's like
Dr. Danter, how cool is it to meet someone who you literally had his heart in your hand at one point?
Yeah.
And then here he is.
Yeah, I mean, last time we met, it was a little less dramatic when I had his groin in my hand. But that was, you know, I guess we had to fix a little wound problem. But I mean, this is why we do what we do. To be honest, I don't, in all humility, it's, you know,
Yeah, but it's got to feel so good.
Oh, it feels amazing. That's what I mean. I just feel uncomfortable getting praised. But
well, you're going to go home to 3 daughters who will knock you down.
Yeah, they'll knock that out of me.
So.
Yeah. No, but I mean, you sort of not gloss over. We sort of forget what a great person Eddie is too. Eddie took care of people with special needs before he did all this. His wife's a teacher. He's got 2 daughters. I mean, if we can't help, if we can't pull out all the stops to help,
such a
in that
valued
situation, then we shouldn't shut the doors. So.
There are a lot of people who are so happy and thrilled, and you do a lot of things just for the community in general, Eddie. It's really, we're all glad you're here. While we love sharing the incredible stories of our patients and our doctors who saved their lives, have you ever wondered what your doctors are like outside of work?
Now for a secret look into the guardians of healthcare at the University of Kansas Health System, let's go behind the mask.
Okay, Dr. Parker, when we go behind the mask, you are outside. You
yes.
love being outdoors. Who are the little humans with you in those pictures, and where are you?
So those are my 3 kids. We're in Canada, and this was in winter, obviously, as you can tell. It's kind of cold.
Do you hike? Do you bike?
Yes, yes, I love hiking. That's, it's a great way to disconnect, and get back to nature, get kind of centered again. So that's my happy place.
Is it Canada or just hiking in general?
Oh, hiking in general.
Being outside.
Oh, being outside anywhere.
Tell us about the cat. We saw a cat there.
Oh, yeah, so that's my daughter's cat. That's our kind of 4th child, if you will. So he gets all the love in our house.
Cats won't betray you. Cats will, your pets will never be mad at you. They're always happy to see you.
Yeah.
Up next we have...
I'm Canadian.
Oh, yeah.
What part of Canada are you from?
We didn't know each other then.
Okay.
But we in Banff. That's Banff, because I recognize it because I got married in Banff.
Oh, well, that's another picture. The next time you're on, I want to see wedding pictures. But for right now, we want to go up to Dr. Danter, because you have been a busy dad with 3 girls heading back to school. Seriously, you're a busy guy. 3 girls, you're outnumbered. Tell us names and ages.
I've never seen those people before in my life. On the left is my oldest, Maya. She's 13. In the middle is Kayla. She's 9. And on the end is Alyssa. She's 6. But she says 6 and a half. Yeah.
So with all the girls in your house, you do need to bro out sometimes.
Yeah,
I
don't never win an argument, but that's fine.
That's true. You never will. However, when you hang out with these guys, do you win any arguments?
Nope, still not. That's my dad on the left and my middle brother Ben next to him, and then me and my youngest brother Pat. We're out golfing at Blue Hills Country Club.
So you're the oldest?
I'm the oldest, yeah.
Oldest of 3. Is that all there is? Three boys?
That was enough, according to my parents, yeah.
So do your parents tease you? They had 3 boys, you have 3 girls.
Yeah, it's because God's a funny lady. You know? She's got a great sense of humor. Yeah.
And your dad is a cardiologist, so medicine runs in the family.
Yeah.
Do your girls want to pursue medicine?
Sometimes. I think they're probably too smart for that. But yeah.
Well, we'll have to see. We'll have to see what happens. This has been a wonder. Oh, we do have one more picture, because why not throw another creature into the mix when you already have 3 daughters? What's happening here?
That is that's our puppy, Penny. She's found a place to rest on the face of my oldest daughter, yeah.
So you have 3 daughters under the age of 14 and you got a puppy?
Yeah, that makes sense.
Boy or girl?
It's a girl also.
Again?
Yeah.
You didn't want a partner or anything?
Nope.
Okay, all right.
I don't make a lot of decisions.
Fair enough. Dr. Danter, thank you. Dr. Parker, such a delight to have you on the show. Eddie, we are so glad that you are here. Thank you for sharing your journey.
Thanks for having me.
And thank you to our viewers for watching. It's been a great discussion. Coming up next week on All Things Heart, an infectious giggle and beautiful eyes. You would never guess the trouble that surrounded this little girl's birth for her mom, the stress that pregnancy put on her mom's heart. That's next Thursday at 8 a.m. And before we leave you, tonight is the first game of the NFL regular season. Go Chiefs!
Red Wednesday, which is usually Red Friday, has become a great Chiefs tradition. It goes back 33 years now. It's an opportunity for the community to come together, celebrate the start to the NFL season, the start to the Chiefs season, but also give back to very worthy charities. Chiefs!
Chiefs are a major institution in Kansas City, and I think that partnership is just a remarkable and really a perfect match for us.
We said it from the beginning, it's not a marketing relationship. We're here to take care of the players, we're here to take care of the staff, we're here to take care of the fans.
Bring it in!
Hey, how are you? I'm good. Good morning. Good morning.
I love the fact that we get to celebrate Red Wednesday with our entire system. This is great. We have multiple locations. I think our teams are just ready to celebrate the Chiefs this year.
This is always an exciting time of year, right? The kickoff to the NFL season. We've got a big game on Thursday with the Baltimore Ravens coming in. Today is just so exciting. It is like Christmas Eve in a lot of ways.
Are we looking forward to a three-peat?
You know, those are hard to do, but I think everybody in Kansas City is ready for one, so let's hope.
Coming up tomorrow on the Morning Medical Update. Back to school and back to stress. If your child was overwhelmed or even suicidal, would you be able to tell? I'm Jessica Lovell on the next Morning Medical Update. An open conversation bringing mental health to the forefront. Hear from two parents turning their loss into a mission. Friday at 8.